Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to the show. Well, I'm here today with Dr. Raymond Phillips, and he's one of my favorite guests on the show. And Dr. Phillips, just tell us a little bit about yourself.
Well, thanks. Thanks so much for having me back once again, Jim. I appreciate it. I'm a gastroenterologist, and that's a specialist in digestive illnesses such as reflux, heartburn, ulcers, colitis, Crohn's disease, and liver disease as well. So essentially anything from in the gastrointestinal system, we're experts in it. And a gastroenterologist has had years of training. 4 years in medical school. I went to medical school at Washington University in St. Louis. Before that, college at Princeton University. But when I concluded medical school, I went on to 4 years of training in internal medicine at Jefferson Hospital in Philadelphia, where I was chief resident. And then after that, because I had an ROTC scholarship in college, I went on active duty, was an internist for 2 years, and then was selected for gastroenterology training at Walter Reed, where I was there for 2 years for training in gastroenterology, and then stayed an additional 2 years on staff doing research and supervising the staff, other staff members as well. But the point is that the reason for mentioning all this is that gastroenterologists have had years of training and that are really experts and issues in terms of the digestive tract, which is very practical because everybody has issues in terms of tummy issues, if you will, and and among the ones that we were chatting about earlier is a condition called irritable bowel syndrome.
Right, that's a big problem with people constipated or having diarrhea, right?
Well,
and there's different treatments we were talking about.
Yeah, and the symptoms you see with irritable bowel syndrome, there are a variety. There's extremes of individuals with constipation or diarrhea, and an intermediate group that may go back and forth between episodes of diarrhea and constipation. But the prevalence of irritable bowel syndrome, it can be up to 30% of women, 15% of men, and the difficulties associated with it can sometimes be so intense that it can prevent individuals from being able to work. And it's one of the major causes for absenteeism in the workplace. So the fortunate thing about irritable bowel syndrome is we have a much greater understanding as opposed to what we had in the 1950s and 60s when we referred to it as spastic colon or spastic colitis, believing that it was just episodes of spasm within the gastrointestinal system. Our understanding evolved. There was a connection in between stress and irritable bowel syndrome. It's thought for a time that psychological issues were an important contributing factor. But now there's a growing understanding that there is a connection between the GI tract and the brain, a gut-brain sort of communication, if you will, that's bidirectional, and that issues with the GI tract can affect how you feel, but also how you feel or other symptoms that you perceive can influence the GI tract. But more research has been done recently in terms of actual alteration in the microbiome as a contributing factor to irritable bowel syndrome. And it's thought that exposure to particular gastrointestinal infections can sometimes even trigger episodes of irritable bowel syndrome. So diagnosis, it can be fairly straightforward. The symptoms are clear cut, and with talking to a gastroenterologist, they can make a diagnosis with a high degree of accuracy with just a limited number of tests.
Not to interrupt you there, but if a person's having diarrhea constantly or is constipated constantly, how long should that be before they come maybe see somebody like you?
Well, typically, if there are new symptoms that have been on and were before that never had those degree of symptoms and they've lingered for more than a month, then it's worthwhile to start seeing a gastroenterologist. Typically, irritable bowel syndrome, these symptoms have been present for more than 6 months or a year's time. So an individual has some degree of experience with them, and oftentimes they'll have experienced symptoms for years and years, from teenage years or young adulthood. So and it can run sometimes in families. So there can be a lot of experience with it, and the trouble is that in years past, since we didn't have a clear understanding of the cause, oftentimes our symptoms were being the principal focus of treatment. If you had diarrhea, we tried to slow it down. If you had constipation, we tried to speed it up. If you're having cramping, we gave you anti-cramping medications. And to a degree, those approaches worked, but they didn't often provide sort of long-lasting or more comprehensive approaches toward relief of the symptoms. Because it's not just an issue of inconvenience of diarrhea or the discomfort of constipation, but often individuals who have this will have other circumstances such as bloating or cramping or abdominal pain, and that can be very debilitating. And as a result, if there's not an effort to try to control those symptoms as well, it can you really won't get a full improvement of their overall quality of life. So now the exciting thing is, because there has been so much research in this area in the last 10 years, a number of new medications have become available that are useful as far as irritable bowel syndrome, and have shown a lot of effectiveness. So for those individuals that have diarrhea predominant symptoms, years ago, a drug that was developed called Lotrinex or Olesitron. It was very effective. Unhappily, it had some side effects, and it was taken off the market, but it's been reintroduced. Very effective for people that have severe diarrhea predominant irritable bowel syndrome. More recently, other new additions would be drugs like Amitiza or Linzess that help in terms of, those are more useful for individuals with constipation. But there are newer additions for those with diarrhea, such as Viberzi, that slow down intestinal activity and minimize troubles with diarrhea, whereas drugs like Linzess and Amitiza are more useful for the constipation predominant sort of symptoms. But so the point is, there is much greater flexibility in terms of treating these symptoms. But some of the other insights that we've had in terms of the cause of irritable bowel syndrome, that is to say, that connection between the brain and the gut, we found that certain medications actually can moderate symptoms by calming down or moderating the degree of perception of symptoms. And it's kind of difficult to describe, but many, or almost most individuals with irritable bowel syndrome have a hypersensitivity of their GI tract. They perceive things much more readily, and that increased perception makes them that much more uncomfortable when they're having issues in terms of intestinal gas or cramping. And some of the medications that we have available now can actually moderate that perception of discomfort. It modulates that hypersensitivity. So that kind of insight into that connection has allowed us to be able to control symptoms more effectively.
So the more sicknesses people have or symptoms in some kind of a problem, the more research there would be done in a particular sickness. Is that what you're saying? Because you said so many people have this problem. Research on...
You're exactly right. And that's how healthcare in the United States progresses. If there's a major health issue that's requiring attention and an intervention, then the pharmaceutical industry is very effective in terms of addressing and providing remedies for that. And that's what's occurred now in the last 10 or 15 years as we've developed a better understanding. The difficulty with irritable bowel syndrome, although it affected so many people, our understanding of it was very limited through limited research. As more research has been done these last 30 years, we've developed a greater understanding. it's provided a better direction for pharmaceutical companies to be able to develop much more effective interventions. And that's what you're seeing here in these last 10 years.
Do older people have more problems than younger people?
No, not necessarily. Just as much difficulties as younger individuals. And it's it can be a problem throughout your lifetime. It's not a problem, say, of middle age or old age. It can affect individuals of any age and then linger throughout your lifetime and be a distraction if you let it become a distraction. And so it is worthwhile if someone has these kind of symptoms and they're unsatisfied or dissatisfied with what kind of progress they're making, would be to see a gastroenterologist and get an understanding of what the condition is, and then be able to have a better direction based under that kind of cooperation with a gastroenterologist in terms of controlling their symptoms and being able to live with it.
Yeah, that's what I always see is, I talk to people all the time and they wait and wait and wait, and I think I always keep telling them, you ought to go see the doctor because there's new medical breakthroughs all the time, right?
Well, yeah, and it just... And
why suffer, right?
Yeah, exactly. When it's pretty clear that something is lingering and it's persistent and it's affecting your enjoyment of life and your profession and your ability to do things, yeah, it deserves some attention. It certainly deserves some attention and not something that should just be endured or tolerated.
Well, Dr. Phillips, thank you for coming on the show, and I appreciate you taking your time out of your busy schedule to talk about this important subject.
All right, thanks, Jim. I always enjoy being here.
Thank you.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you are looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.